I'm Dr. Barb DuPree, gynecologist, menopausal care provider, and founder of the website Middlesex MD. Today, let's talk a bit about pain with intercourse. There are many reasons for women to experience pain with intercourse. Some are fairly common, but there's a commonly overlooked cause of painful intercourse. It's called vaginismus. Vaginismus is a term that refers to too much pelvic tone in the pelvic floor muscles. Think about the pelvic floor muscles as a trampoline. They crisscross across the lower pelvis and they support all the organs above that. When those muscles get too weak, women might experience pelvic organ prolapse. But when those muscles become too taut or tight, they might experience pain with intercourse. Just this week, a patient presented and said, "I feel like he's hitting up against something, or there must be a tumor or something growing in there. There just isn't enough room in the vagina." Those are the classic words used to describe the symptoms of vaginismus. The muscles become tight for a number of reasons. It might be the painful sex itself leads to that, maybe pelvic injury, pelvic surgery, or sometimes for no reason at all. But over time, the muscles get too taut or tight, making a constriction just inside of the vagina, making intercourse somewhat uncomfortable and maybe impossible. A careful pelvic exam is necessary to make this diagnosis. Unfortunately, it's very treatable. It often involves pelvic floor physical therapy and possibly the use of dilators. So if those are the complaints you're experiencing with intercourse, make sure you bring it up with your provider, and a careful exam can help in making the diagnosis and follow with successful treatment.